Hello, welcome to the LA Institute video series. My name is Dr. Jose Luis Ruiz. And on this very important video, we're going to talk about adhesion and bonding systems in dentistry and how to be successful with them. So everything, when it comes to modern dentistry, has to do with adhesives. A great deal of what we do depends on strong, durable, well-sealed restorations. And so the proper use of adhesives is key for modern dentistry. So the objective of this little presentation is to discuss the principles necessary to achieve success with adhesives. Now, the first thing that we need to do is really start thinking about trusting adhesives. If we want to get ourselves involved in supra-gingival, minimally invasive dentistry, we have to trust adhesives. You see all the preparations that the LA Institute promotes are preparations that have zero mechanical retention. All of our the retention depends on adhesives, and I've had lots of my colleagues question whether this is going to last, and really I can tell you that the literature is clear that adhesives work, and I can tell you firsthand I placed thousands of restorations. They're fully retained only by adhesion, and I've lost literally a handful over all this past 15 to 20 years of adhesive dentistry. So, and I place thousands and thousands of them. So I have absolute trust in adhesion. And by the way, in modern society depends on adhesion a great deal. Even airplanes, cars, everything that we're surrounded by is using adhesives instead of screws, instead of a number of different other things. So if you're afraid of adhesives, you should be a little bit afraid of getting on a modern plane these days, because some of the most crucial components of them are retained by adhesives. So the dental bonding systems have been around already for several decades. We know historically the first 3 generations of bonding systems were not successful, and because we were not able to bond to dentin. Bonding to enamel has never been a problem. Bonding to dentin is what's been problematic all along. We need to start by kind of understanding what's important. What do we need when it comes to adhesives, to bonding systems? And a lot of people just focus all their energy in finding the strongest bond. And let's be honest, bond strength is important, and we want good bond strength, but it's by far not the only thing that we need to worry about, because what is the benefit of having super good adhesion if a patient has post-op sensitivity and they're in pain? We all know that. We all went through all of that during the early history of adhesive dentistry. When we were doing direct composites on the posterior area of the mouth, patients had post-op sensitivity even with the smallest little restorations that we did, and that was huge failure leading to huge amount of root canals and a lot of unhappy situations. So let's be clear, bond strength is not the only thing that we need. We really need adhesives that minimize chances of post-op sensitivity. We need adhesives that are simple. We need adhesives that are easy to use. What is the benefit of having incredibly great adhesives that are so complicated to use that only a few people can use them? And of course, we need bonding systems that are more durable. We're all concerned about the fact that when we bond to dentin, that bond it decreases dramatically over time. So there's a few things that we need when it comes to adhesives, and again, it's much more than just bond strength. Bonding to enamel historically has been very predictable, very easy, And quite honestly, you know, we it hasn't really changed a great deal since it first was introduced by Michael Buonocore and Ray Bowen. So the only thing that really has changed is that at the beginning, you know, the beginning of bonding to enamel, we were etching the enamel for a full minute, and we have learned over time that by etching the enamel for a full minute, in fact, we weaken the enamel, we weaken the rods, and instead of having better bond strength, we have less bond strength. So nowadays we're more, you know, somewhere in between 15 to 25 seconds of etching. Usually, you know, usually 20 to 25 is sufficient. All the problem, as we all know, has been bonding to dentin. The first 3 generations of dentin adhesives really didn't do anything. They didn't work, so they were unsuccessful. And all the future generations of bonding systems have been all to do with dentin bonding. You know, again, the adhesion to enamel has not been a problem for all these years. The 4th and 5th generation is Total-Etch bonding systems. The 6th and 7th generation is self-etch bonding systems. Now, we keep having people change terminologies of bonding systems, and in an effort to simplify, I think sometimes we overcomplicate things and everybody gets confused. So there's other nomenclatures, other ways to name the different bonding systems. At the end of the day, I think that you know, if we understand there's a self-etch or a total-etch, it really makes it pretty simple. So the first bonding systems to actually work on dentin was the 4th generation bonding system, which was first introduced by Fujiyama and Nakabayashi, when we learned that actually etching the dentin was not going to kill the pulp, and when Nakabayashi introduced hydrophilic resins, or in other words, HEMA. And since then, you know, adhesive dentistry really has changed the way we do restorative dentistry. 4th generation bonding systems have a long history of success. They're excellent materials, and we're, you know, we all have used them. The way they work, as we know, is we first use an etch or an acidic etch, which is phosphoric acid, and that phosphoric acid basically dissolves the mineral components of both the smear layer and the dentin, and then we go back and wash it off. If you see the circle on that picture, that circle depicts a dentin that has been washed off the minerals in the smear layer, and all of a sudden we have exposed tubules. And the purpose of that is because then the next step is we're going to apply this hydrophilic resin, or HEMA, and that hydrophilic resin, which still likes a little moisture, is going to go down into those tubules, create resin tags, mix with the mineralized dentin and create hybrid layer. And this, you know, mechanical chemical adhesion is very, very strong. And again, it was the first successful adhesive for dentin. Then we place the 3rd component, which is the bond, which is a hydrophobic resin, and that the entire complex becomes more stable. The problem with total-etch bonding systems is that they are difficult to use. And this is why. One reason is because when we etch the dentin, we use acid to etch the dentin, just like we can over etch enamel. We were talking about that earlier. We can easily over etch dentin. If we apply our acids to etch the dentin and we leave the acid, the phosphoric acid, too long, that etching is going to get too deep, where the resin, research shows that the resin will not be able to go that deep, and then all of a sudden we have a layer of dentin that has been demineralized, but it has not been replaced with resin. That will lead to post-op sensitivity and weak bond. Another problem with Total-Etch bonding systems is that they're very moisture sensitive. When we remove the minerals from the dentin, we only leave fibers, floating fibers. They can easily collapse when they're over dried. So if we dry too aggressively, when we're washing off the phosphoric acid and then try to dry, if we dry a little too aggressively, we will collapse the fibers. On the other hand, if we leave a little too much water, then HEMA likes a little moisture but not a lot of moisture. So that perfect balance of not too wet but not too dry can be complicated. And again, if we have either one of those extremes, then we will have post-op sensitivity, we will have weaker adhesion, and really, I mean, scientifically we do know that if we use the Total-Etch bonding systems correctly, and some people have become masters at using Total-Etch bonding systems, we know that they work and that we can use them pretty predictably. The problem is that they're difficult to use, and surveys done by CRA or CR and other groups have shown that people that use Total-Etch bonding systems report a dramatically increased percentage of post-op sensitivity compared to people that use self-etch bonding systems. So it's almost a no-brainer. If we have occasional post-op sensitivity and it's unexplained and that keeps happening to us, then we need to switch, because self-etch bonding systems are bonding systems. They are far easier to use. So the literature is very clear on this. I mean, even people in the literature they're very insistent in the use of Total-Etch bonding systems because they think that historically they're better. In their articles, they show a huge percentage of post-op sensitivity. And right here on this slide, we show a couple of those research studies. And really, we have to be a little more realistic when we have patients and we have practices. Post-op sensitivity can be, the worst enemy of a happy practice. So, for that reason, way over a decade ago, I switched completely to self-etch bonding systems, and I cannot tell you how happy I am. I've used a number of different systems throughout the years. And we learn a little curve. There's a little curve of learning when it comes to using these bonding systems, but at this point in history, we know everything that we need to know about, how to use them with success and predictability. So the sixth generation self-etch bonding systems are the two-bottle systems. The seventh generation self-etch bonding systems are the all-in-one. The sixth generations are systems like Clearfield SC Bond, Clearfield SC Protect. The seventh generation bonding systems are systems like Futura Bond, iBond, and they have shown to be very successful. The key is using them correctly. How do they work? Well, basically, self-etch bonding systems work by using an acidic resin. The acidic resin is the primer, and what it does is when we apply that primer, we don't need phosphoric acid anymore. The primer is the acid. It's basically an acidic resin. The acidic resin is applied on the dentin, and if you see the red circle on this photograph, you'll see that the smear layer is never removed. The dentin cannot be over-etched because the acid, which is the resin itself, can never go any deeper than itself. So basically, you will never have the possibility of over-etching, and you will never have the possibility of leaving tubules unprotected because you never uncover the tubules. So these bonding systems are developed. They're better designed. That allows things to work, with less complications. So that acidic resin will demineralize the smear layer, demineralizes the dentin, it mixes itself with all this, you know, all these structures, and then you know, once it hardens, it becomes your adhesive. It gives you a very good adhesion. And then on a 7th generation bonding system, you have the second component, which is a hydrophobic resin, which strengthens this whole complex and it makes it more durable. On the 7th generation bonding systems, it's all combined in one drop, and one drop will do it all. So the advantages of self-etch bonding systems is that, first of all, research you know, shows that the self-etch bonding systems can give us very, very good bond strength. So, you know, systems like for example, right there is Peak SC. It gives us some of the strongest adhesion to dentin recorded with any bonding system. So we don't lose if we use a self-etch bonding system. We don't lose in bond strength. It depends on what bonding system you use. You can achieve very, very high levels of adhesion to dentin, comparable to Total-Etch bonding systems. And an extra benefit is the moisture is not a concern, because since we don't demineralize dentin and then wash it off, wash the minerals off, we never have you know, fibers. They're just unprotected. So if the dentin is a little wet, if the dentin is a little dry during this procedure, it doesn't make much difference, and the research shows that. One of the biggest benefits of self-etch bonding systems is durability. We know that when we bond to dentin, all bonding systems decrease over time. That adhesion decreases over time. But that, in fact, is higher when we use Total-Etch bonding system. First of all, because we always run the risk of over-etching the dentin and not replacing the mineralized dentin with resin, as we talked about earlier. Another reason is the research shows that sometimes sometimes we traumatize the dentin with too much acid, and that weakens that dentin. Research is showing more and more currently that there's some bonding systems that are showing incredibly long-lasting adhesion to dentin that is starting to almost last as long as bonding to enamel. That, in fact, has been my personal experience with newer adhesives, with adhesives like Clearfield SC Protect, Clearfield SC Bond, where these adhesives do not irritate the dentin. They have low acidity, and when I have found myself with the need to remove old restorations, I have found that my adhesion to dentin was not lost even after 10 years. So it is pretty impressive, and I mean, my personal experience has been consistent with what research is showing. Nevertheless, there is one small disadvantage with the self-etch bonding systems, and that is that self-etch bonding systems don't etch the enamel very well. And we all have experience using self-etch bonding systems as the manufacturers recommend, and ending up with like yellow and brown margins, and it makes us very unhappy when we see that. And the reason why is because they don't etch the enamel very well, especially non-cut enamel. So what are we going to do in those cases? Well, let me tell you that more than 10 years ago, I did a study with Dr. Werner Finger, and Dr. Werner Finger is the inventor of iBond and the inventor of Gluma and a number of other products that we use in dentistry a great deal. And basically our study was to compare the bond strength of iBond, which is his invention, when we use it on enamel straight, and compare that with etching the enamel first and then utilizing iBond on top of that. And as you may imagine, when we etch the enamel with phosphoric acid and then use iBond, we double our bond strength compared to just iBond straight onto enamel. So since then, I mean, it's been logical to me that I etch the enamel selectively, try to avoid etching the dentin when I'm doing this, especially the uncut enamel, and then use my self-etch bonding system, whether it's iBond or whichever material I choose to use. And by doing that, you get the best of both worlds. Now there's one more benefit to etching the enamel, and especially the uncut enamel, and that is that we increase the seal. The seal and bond strength are two different things, and research, the most current research, is showing that when we etch the enamel and we use a self-etch bonding system, we enhance our seal. So again, it's all beneficial to the long-term success. So right here we see a situation where we're doing a couple of occlusal and occlusolingual restorations, and we're applying a little bit of etch selectively, trying to not get into the dentin as much as possible for about 10 seconds, and then we wash it off. So the benefit of that again is that it increases bond strength, especially the uncut enamel, and it also increases seal. Now what happens, as you saw in the video, what happens if by mistake we end up putting a little bit of etch on the dentin? Of course, we're not perfect, we're human. What would happen? Well, I did a study with Akabashigawa, and we wanted to see what would happen in this particular technique if we, by mistake, happen to apply a little etch on the dentin, and we discovered that it makes no difference. 10 seconds of etching doesn't do a great deal of difference whether we're using his invention, which is Optiball FL, or Clearfield SC Bond. So, you know, our intention is to selectively etch the enamel, but if we happen to slightly etch the peripheral dentin, is not going to be, there's not going to be any major consequences. Now, I do encourage you to be careful to not be sloppy and allow etch to get into the deeper parts of the dentin or close to the pulp, because then we may encourage or we may increase the chances of a little sensitivity. So if we happen to barely touch the dentin in the periphery, that's not a big deal. One more thing that we want to remember when we're using adhesives is that the technique is king. You know, really, all the studies that you see on the screen consistently show that the operator has a big influence in the success of the procedure. The same bonding system on the same tooth, you know, placed by different people will give you dramatically different results. So technique is king, and it's very important that we pay attention to all those little things. So let me share with you a few of those little things that are important. And one of them is, if we want less, you know, more success, we want to have a clean tooth. If you have saliva, blood, or anything on the tooth, it will contaminate the tooth, and it will decrease your bond strength, will increase your chances of problems. So have a clean tooth. There's a number of different ways that you can do that. You can certainly use tooth cleaner or something like Concepsis from Ultradent, or you may choose to use a bonding system that includes the disinfectant. And you know, one such material is one of my favorite bonding systems, Clearfield SC Protect. And the bonding system itself, the primer itself, has a monomer that is a bactericide. So it really cleans the bacteria, kills the bacteria, and it gives you a nice situation. So you know, you want to have a clean tooth when you're working on when you're doing your adhesive. The next thing that we want to do is routinely, if I'm going to be very deep, I most of the times like to apply that little red line that you see there is a little liner. I like to use you know, a glass ionomer, resin modified glass ionomer liner like Ionoseal from Voco or Vitribond from 3M, but only on the very deep areas, more than 4 millimeters, 4 or more millimeters. I usually will line them. Less than that, I will not line. Then the next step is always going to be to etch the enamel, and again, not only etching to the cable margin, always go a little bit beyond, a millimeter beyond the cable margin, because that uncut enamel is the most problematic enamel. So etch the enamel, go slightly beyond, try to avoid etching the dentin as much as humanly possible. 10 seconds, wash, dry. Remember, because we're using self-etch bonding systems, if it's a little wet, if it's a little dry, it's not a big deal. It's better if it's a little dry, but we certainly don't want to desiccate the tooth. So, you know, when you're drying, you want to make sure that you use your air, and you it has to be dry air. And when you're drying, you're gonna see that the tooth starts, it goes from wet to slightly shiny. When you don't see water on the tooth, that's good. You keep drying, it might start losing the shine. That's okay. You don't want to go any more than that, though. You don't want to over desiccate. Then after that, you're going to apply the primer. The primer is basically a hydrophilic, an acidic resin. The primer is an acidic resin, and that acidic resin is going to etch, is going to dissolve the minerals on the smear layer and the dentin. You're going to apply the primer also on the enamel. Although you already etched the enamel, but you're also going to apply a little primer on the enamel. And usually you want to use a micro brush, and you want to agitate the primer on the dentin, not the enamel. It's not necessary to agitate the primer on the enamel. It is desirable to agitate the primer on the dentin. Now, after we have done this for about 25 seconds, and you do need to make sure that you give it enough time. If you don't give the primer sufficient time, it's not going to etch correctly, it's not going to infiltrate correctly, and you're going to lose some of your ability to bond and seal your tooth. After you have done that for 25 seconds, the next step is crucial. You must get rid of the solvent, because all primers have about 98% of solvent. Solvent meaning water, acetone, ethanol, and any of those solvents are negative for the long-term, durability of your bond, and they're also negative in regards to post-op sensitivity if you leave them there. And it's not difficult to leave them, believe it or not. If that primer is not fully evaporated, you're going to have water, ethanol, acetone left inside. So how do you make sure that you remove it? You need to visually confirm it. So you're going to blow air. You're going to see that, when you're trying to evaporate the primer, you're going to see the primer move. When you see that it stops moving, that's when you know that you have evaporated all the solvent. So now right here we see a live case when we are first etching, and we etch for 10 seconds. Only the periphery. We were careful not to etch the middle part of the tooth, the more sensitive part of the tooth. Of course, you must have a good isolation. That's so important. Any contamination will lead to failure when it comes to adhesives. Right there, you see that I'm applying the primer. I'm agitating the primer on the dentin. Be plentiful with the primer. You see how those are only preparations that have no mechanical retention. I'm not worried one bit. I know that I trust in adhesion. I only have a few thousand restorations that I can fall back on, knowing that it works. So I keep applying the primer, keep agitating, and after 25 seconds I start drying. As you see, as I'm drying, you can see the movement of the bond. I keep drying as long as necessary until I see that the primer doesn't move anymore. At that point, I'm comfortable that I have removed the solvent. And then, in this particular case, I use a 7th generation bonding system, so I'm actually going straight to a cement and seed my restoration. Now, of course, the same technique is what we saw in the video. We saw, in fact, the cementation of an onlay, but the technique is the same. It doesn't change. If we're going to use if we're going to use our self-etch bonding systems, where, you know, depending on what bonding system you're using. In that particular video, I was using something like Futura Bond DC. That's a 7th generation bonding system. It's a dual cure from material from Voco, and it you know, it is a dual cure. So you apply it, being that it's a 7th generation bonding system, it's all in one. There is no separate primer or bond. You apply the bonding system, you agitate for 25 seconds, you get rid of the solvent, and you're done. You're ready to cement your onlay or to cure and start placing your filling. So the procedure, you know, really is consistent with whether it's a 6th or 7th generation bonding system. So in conclusion, you know, your goal is to trust in adhesives. They work. We know that they work. We know the self-etch bonding systems. I mean, I personally can tell you that I love self-etch bonding systems. I know they work. And today's self-etch bonding systems are in fact superior to total-etch bonding systems for a number of reasons. And let's remember that it's not just what bonding system we use, but it's very much how we use it. And on this video, I have shared with you some of the most important things that we need to keep in mind in order to have success with adhesives. Another important thing that we need to keep in mind when it comes to adhesives is proper curing, because most of the adhesives today require light to cure them, and improperly curing adhesives and resins have become a major concern. If our lights do not have the sufficient milliwatts required to activate our initiators, then we could end up having bonding systems or composites that are improperly cured, and that would lead to failure, and you know, whether it's with sensitivity or with the restoration not bonding correctly. So proper curing is a must. So it is very important to properly cure your bond and your direct composite and your cement. So the speed of cure doesn't really make that much difference. The literature and CRA has been pretty clear on this. I personally like to use a very fast curing light. I use the Ultradent's Valo, and it's a 3-second light. And you know, the important thing is that we cure our restoration and our bond correctly. So when we fulfill all of those requirements, we can trust in adhesion. Adhesion works, and it is really a pleasure to have shared this information with you. You are welcome to go to the forum of the LA Institute if you have any questions, additional questions about this subject. Otherwise, have a great day.